Well, welcome into To Your Health. You know, last week we talked about exercising starting with walking. You're not going to walk if your feet bother you. So we want to make sure that we have good, healthy feet, and we want to make sure that we're taking good care of our feet. So today on the program, we're going to be talking about more foot care to make sure that you can maintain a good, healthy foot. And I have with us two podiatrists. Today we're going to make you the left foot podiatrist, and we're going to make you the right. No, it's Dr. Brian Kille and Lashonda Kille, and we're so glad to have you guys here. You're with Greenville Foot Care Clinic, but you have an office in Montgomery and an office in Greenville, so we don't get anybody confused about, I got to go all the way down to Greenville just to get my feet checked? No.
That's right.
So today we want to talk about how do you maintain, especially as you're aging, because it seems like as people age, they tend to have more foot problems. And maybe it's because you're overweight. That probably has a bearing on it too.
Sometimes.
And maybe it can be nutrition.
Right.
So I know our bodies are a complicated amount of different types of things going on. So let's talk today about maintaining good foot health.
Okay. Well, one of the most important things is to keep your feet clean.
Okay.
And what I see
Now,
a lot.
when you say keep them clean,
Yes.
a lot of times you're taking a shower, the water goes all the way down and hits them, they're not really getting clean.
Right.
Right, okay.
The soap running
It's
off your
either-
body and
it's
then
either-
rinsing.
It's either in the bathtub, it's a little easier because you look down, that guy's staring right at you. In the shower, it can be a little difficult. So regular soap, is the same way you're going to wash your hands, wash your feet.
Exactly. And wash in between the toes.
In between the toes.
Right.
Very important.
And as important as washing them is drying, and drying in between the toes. I see a lot of just
Okay.
kind of quickly dry, put my socks and shoes on and run out, and that can
Yeah.
cause a huge problem with a lot of excessive moisture in between the toes.
Okay.
So that can lead to fungus in between, breaks in the skin, which can lead to ulceration and infection.
Wow.
So just as important as washing is making sure that the toes are dry, especially in between, and that there's a little bit of time between the time that you've gotten out of the shower, dried your feet, and then put your socks and shoes on.
Okay. Interesting question, because my wife goes and gets a pedicure. And I keep thinking, I don't want anybody pedicuring my foot. I don't mind if somebody rubs my foot a little bit, but so obviously your toenails and the toenail that's a part of the foot is in your practice also.
That's
so
true.
you do look at things. And how do you is there such a thing as maintaining good nail health on your feet?
Well, it's a complex situation because a lot of my patients will come in and say, well, I've been told to cut my nails straight across.
Okay.
And a lot of people...
Continue on, buddy.
Yeah,
because,
a lot of people will tell
Yeah.
them that because that's the easiest way to prevent an ingrown toenail.
All right.
Of course, now you also have to watch those sharp corners, catching on your socks,
Yes,
and then ripping
yes.
the nail off, which is another problem. So I tend to tell people, look, you can round your toenails off. Get a file, make them nice and round, so they got a nice little arch to them, and then they won't catch on things and rip off. And as long as you stay beyond the outer edge of the skin, then unless you have a genetic ingrown toenail, you shouldn't have to worry too much about that kind of stuff.
I
So
generally
that's
tell
one.
them to follow the contour of their nail.
Follow the
because
contour
if
of
they
the
have
nail,
a square nail, it's okay to cut it straight. If their nail is more rounded, you just follow the contour, whatever the shape. And like he said, as long as you're staying, not getting too close.
I'm 77 years old, and I've never really looked down and said, am I a square or am I a contour one?
Well, I mean,
but I guess I cut, or my wife, thank God, knock on wood, she's real good about saying, well, I'm going to cut your toenails for you. So maybe that's how I'm getting my pedicure.
Maybe so.
maybe, yeah.
Some things that we can see within the nails helps us to diagnose different diseases as well. So when we're doing a foot exam, we'll look for nail changes that can be indicative of things like psoriasis or respiratory disease. Some things show up in toenails and fingernails before they show up in anything else.
It's neat. How important is that shoe you put on your foot? Because, you can go to Walmart and buy a pair of shoes that look like, hey, these are great, and they're going to cost you $15 or $18 or $20. And then there's some shoes that are, maybe $150 or $200.
Right.
Should we be doing something special as we choose our shoes?
The
So,
most
choose our shoes.
Right, choose our shoes. The most important thing is to have your feet measured. And as you get older, your shoe size can change. So I usually recommend that you have your feet measured once a year. And you're going to measure both feet.
Do you guys measure feet?
We do in the
Okay,
office.
because I want to say, years ago, and I'm 77 years old, so I remember the days when you went into a shoe store, in a shoe department, and they put your foot
They
in there.
broke
and
out that
they-
Brannick
they
device.
That's
Not
right,
anymore.
and they measured your foot.
Right.
Nowadays, with everything kind of cut back as we do, I don't think anybody's measuring anybody's feet.
No one's measuring, and 90% of the time, patients come in wearing the wrong size shoe, which leads to a myriad of problems. So
Okay.
one of the first things is, there's usually some type of measuring device at shoe stores if you request it or it's
Okay,
sitting out. So
right, okay.
use that, measure, and you want to buy the shoe that accommodates the largest foot. So if your left is
All
bigger
right.
than the right, then you'll buy according to that foot size. Too big is a problem, too small is a problem.
All right.
A shoe that's too big will lead to pistoning in the shoe, and you'll tend to jam the toe at the end of the shoe, which causes
Every
nail
time,
every
yeah.
time.
Or-
nail
or-
changes.
Or you'll get shearing calluses on the bottom of your foot
Sure.
from
'cause
that back
from
and
that
forth
rub.
blister.
Right,
Yeah.
rub, yeah.
And also, patients that have problems with sensation, which can happen from different medical problems. They have nerve damage and they really can't feel well. They will have problems with buying shoes because they will put a shoe on and they won't necessarily feel if that shoe is too tight or too loose.
It'll quote unquote feel fine.
It
Right.
will, exactly.
Until
So,
a month later when it doesn't really feel fine.
right.
Yeah.
So it's important for them to be able to feel and press to see where their toe is in that shoe. But speaking about having poor sensation, we do see a lot of patients that have nerve damage.
Oh, yeah. So basically, going back to the $18 shoe or the $180 shoe, I'm sure it's the quality of the shoe and the fact that it can give you support. Because why do we wear shoes? Are we better off to walk barefoot or to have something covering your foot?
Generally, you're better to have something covering your foot.
Okay.
I mean, I know hundreds of thousands of years ago we probably walked barefoot, of
Sure.
course, but
But we didn't live past 35.
right, we
Right.
didn't make it very long
40,
either.
yeah.
No, I mean you need to support. One thing to remember is that shoes, though, are only going to support you for 3 to 6 months, depending on your activity level, and then any support that shoe has is going to wear out. Simply because they
okay.
don't make them and design them with a longevity in mind. They want you to buy
Right, right.
shoes over and over again.
Right.
Whereas sometimes the devices we make for you will last 20 years. And so they cost a little more upfront maybe, but you got
So
a
when
long-term
you say a
investment.
device, that's something that you can put into an existing shoe, or do you actually make a shoe?
No, we make a device to put into your
The
shoe,
that's gonna,
whatever
give you
shoe
this- yeah.
that you want to wear, and then that'll give you your arch support and it won't wear out.
and that'll help you with your overall foot health.
Yes.
Yeah, 'cause
Yes.
it's designed to be that way, and it's designed, again, measured for your foot, each foot individually.
Right.
Molded to your foot,
Right,
actually.
right.
Yeah.
And that's the best way to do it.
Absolutely.
Great. Well, listen, this has been great. If anything comes up, call me back. If you said there's something new in feet, something new in
Something
feet.
new in feet.
Something new in feet, we've got it. And just remember this, that they're in Greenville as well as in Montgomery. You do not need a referral call. Most insurances are taken, but if your feet are starting to bother you, obviously you might want to start with your regular doctor on a regular visit, but they're going to just go so far. That once a year comprehensive foot exam can do you a wonderful good as far as your good overall health. And we'll be right back right after this.